Hi, my name is Nadira Izzati and I'm going to tell you a little bit about employee health and safety. Okay, for the introduction, we need to know that as defined by the World Health Organization, also known as WHO, occupational health deals with all aspects of health and safety in the workplace and has a strong focus on primary prevention of hazard. Do you know that there is 1.9 million people die in 2016? It is because of the work-related disease and injuries in the exposure of long working hours, air and noise pollution in the workplace, and ergonomic risks. Do you know that in 2019, a growth rate in death of employee has increased due to COVID-19 infection in the workplace? As we know that in 2019, the world has this outbreak COVID-19. And people were dying, and the world can get the vaccine as fast as we want during that time. Okay, we're moving forward to the next slide, which is what is employee safety and health. Health and safety at work refer to all aspects preventing and protecting the health and safety of employees during their current or previous activities, including workplace accident, occupational disease, and others health issue and illness related to the workplace. For example, about the mental illness of employee, maybe they can provide the counselor for them because sometimes they just need someone to talk. Okay, next, the element of a successful organization. The organization maybe can prevent the workplace injuries and illness. Other than that, they can improve compliance with laws and regulation. Okay, next, they can reduce costs, including significant reduction in workers' compensation premiums. Other than that, they can engage workers, enhance their social responsibility goals, and increase productivity and enhance all business operation.
Management and supervisor both play critical roles in ensuring employee safety in the workplace. However, their responsibilities and areas of focus are different, and it is important for organizations to understand and utilize their roles effectively. Management, which includes executive and upper management, is responsible for setting the overall safety strategy and policies for the organization. They determine the resource that will be allocated to safety, including budget and personnel, and ensure that safety regulation and laws are being followed. They also have the authority to make decisions that affect the entire organization's safety performance, such as implementing new safety technologies or procedure. Management is also responsible for creating a safety culture within the organization, which includes promoting safety awareness and encouraging employees to report safety incident and hazard. This is important as the safety culture help the organization to identify potential hazards and incidents that are not reported, hazards that are not addressed. Supervisors, on the other hand, are responsible for implementing the safety policies set by management. They are in charge of enforcing safety regulation and ensuring that employees are working safely. They conduct regular safety inspection, provide training, and resource to employees to help them work safely, and ensure that all employees are aware of and understand the safety policies and procedure. They also play a key role in identifying hazards and ensuring that employees are aware of them and take the necessary precaution. Supervisors are also responsible for addressing any potential hazard in the workplace, such as equipment malfunction or unsafe working conditions, and taking corrective action to prevent accidents or injuries. They also play an important role in accident investigation and ensuring that safety incidents are reported and tracked, which help the organization to learn from incidents and prevent them from happening again.
I will explain about occupational
safety law. There are a few laws that companies are required and crucial to follow for our own safety. The main law governs these issues, which is in Factories Act 1934. All the provinces that under this act need to have devised factories rules. There are few laws that are related, such as Dock Laborers Act 1934, Mines Act 1928, Workmen Compensation Act 1928, and Provincial Employees Social Security Ordinance 1965. This is a few acts that organizations need to follow for everyone's safety. So, how the labor laws cover these issues? This will focus on cleanliness of every place in the workplace, disposal of waste and influence, overcrowding, lighting of the place, and drinking water. Next, for responsibilities and rights of employees and employer. For employee, they need to work safely to protect of themselves and serve others from injury and follow all of the occupational and safety, or in short form that called as OHS instructions. For example, where all personal protective equipment provided follow safe work procedures. For the other one is report any OHS issues including the hazard injuries, illness and near misses. Next, for employer, they need to provide properly orientation, training and supervise all staff to ensure safe work practices are understood and followed by all employees. Second, consult with all employees including that related with decisions that will affect in the workplace. For the last one is provide suitable personal protective equipment or PPE to make sure every single workers can do their job safely and train them how to use PPE correctly so that they know how to wear it.
My name is Nur Zati. I will present what caused an accident. The most common workplace accident and the reason for them occurring are two sides of the same coin. While there are absolute cases of freak accident causing harm that no one could have averted, it's also true that without the hazard that often go unnoticed and undressed. There will be far fewer incidents of workers becoming seriously hurt or injured while at work. Here are some common accidents you should be aware of so you can look out for the hazard that caused them. The most common accident at workplace is slip, trips or falls. Just what it says on the tin, this type of accident occurs when there are tripping hazard on the workspace floor, which is ordinarily occurs with an untidy or disorganized environment. Similarly, slip commonly happen when floors are wet, perhaps without a warning sign erected to warn those nearby of the increased risk. The second one is handling, lifting or carrying. Handling heavy objects without proper training can be a recipe for disaster, with workers suffering from an injury or in some cases long-term chronic neck, back or spine issue. Formal instruction on how to bend, lift and carry with minimum stress on the body can help here, or the introduction of equipment to reduce the need for doing the job manually. The third one is struck by moving object. This is wide-ranging category that covers everything from object coming loose from a higher surfaces to a vehicle striking workers or pedestrians. The fourth one is act of violence. Some job roles require employees to regularly interact with the public, and with this come the danger that will find themselves in a violent situation. Those in the retail industry or someone working as a security guard are just two examples where this type of risk is more prevalent. The last one is falls from the height. Another self-explanatory one. Falls from height are any instances where an employee is required to work from high place and is thus at risk falling. Height in this case often categorized as anywhere above ground level and can lead to serious injury should the proper precaution not be put in place. Next slide, I will present about how to make it not accident at the workplace. Accident can happen at any time in the workplace, often when you least expect them. However, many on-the-job accidents can be avoided by focusing on safe practice and taking necessary safety precautions. one is know the hazard. The cause of accident can almost always be traced to a dangerous act and unsafe condition or a combination of the two. In the most instances, an accident could have been avoided by following proper safety precaution. In order to avoid accident, it's important to understand what can cause them. There are countless unsafe acts and conditions that can lead to accident, but some common hazards include using defective or broken equipment, performing tasks without training, failing to wear proper PPE, unsafe handling, storage or disposal of materials, injuries due to poor housekeeping, and the last one, horseplay. The second one is safety to avoid accident. The first step to keeping yourself and co-workers safe is to stay alert on the job and not let routine or familiarity lure you into the carelessness. Always observe safety precaution before and during a task, even if those precautions make the task more inconvenient or take longer to complete. Cutting corners may not seem like a big deal, but doing so is primary cause of accident. Focus on a good habit. It's human nature to work yourself into habits, and when you break a safety rule, you've been taken the first and most influential step in forming a bad habit, a habit that can lead to an injury. Good habits such as following safety precaution and noticing unsafe conditions are just as easy to form. Develop a safety attitude is probably one of the most difficult things to recognize because most of us have the mistaken notion that it's always someone else who gets hurt, never us. If we all do our share in observing safety rules and staying alert for unsafe conditions, everyone will be benefit. And the last one is having accident prevention program. What are the benefits of good accident prevention program? It will detecting and dealing with hazard before they cause injury or illness is a far more effective and sensible approach. The main goal of health and safety program is accident prevention to reduce workplace injuries, illness, and death.
Hi and Assalamualaikum. Before I start my presentations, let me quickly introduce myself. My name is Nur Shahira binti Zulfazali and my ID number is 2022909853 and I am event management student. Alright, so my part is how to prevent accidents. Improving workplace with the 5-step accident prevention plan are: first is written safety and health policy. Second is orientations and training. Number 3 is safety and health program coordinations. Number 4 is record keeping and data analysis. And lastly is regular communications. Alright, so we move to the next slide. So this slide will be reducing unsafe acts through selections and placement. Alright, so the study found that employees did develop consistent perceptions concerning supervisory safety practice. Number 2 is proper employee screening and placement can reduce unsafe acts. Alright, so number 3 is using the Economic Research Institute, which is ERI, in the selections process seems to be associated with reductions in work-related accidents. Alright, so let's move on to this slide, which is typical workplace exposure hazards. Alright, so first is chemical and other hazardous materials. Number 2 is excessive noise and vibrations. Number 3 is temperature extreme. Number 4 is biohazards, including those that are normally occurring, such as more man-made, such as attracts. And number 5 is slippery floors and blocked passageway. Alright, so we move to last slide, which is remedies. Steps to prevent the entry or spread of infectious disease into workplace. Number 1 is provide a daily medical screenings for employees returning from infected areas. Number 2 is deny access to facility for 10 days for employees returning from affected area. Number 3 is clean work area and surface regularly. Number 4 is stage breaks, which is offers several lunch periods to reduce overcrowding.